Good morning to all of you that are joining us. I'd like to welcome you to the Caring for the Caregiver presentation today on POLST, which is the Physician Order for Life-Sustaining Treatment. First, I'd like to thank our partners, Sutter Health, for putting on this great educational opportunity for our community members. A great way for us to learn valuable resources that can help us all care for ourselves as well as for others. So thank you, Sutter, for collaborating with us on this project. I would like to introduce our speaker. Her name is Christine Stewart. Christine Stewart has been a registered nurse for the past 30 years. She's also been part of our community hospice family for the past 30 years. She started her nursing career at Doctors Medical Center, where she worked for 3 years on the oncology floor. During that time, she volunteered for community hospice as a family visitor, and that's where she quickly learned that she had a calling to help others at the end of life, and she became the organization's first weekend on-call RN. Her love continued to grow for the organization and the patients and families that we've been honored to serve throughout the year, and she has continued to take on additional duties, becoming a full-time case manager. Currently, Christine Stewart serves as our Director of Palliative Care Services, our Community Care Choices program, as well as all of our pediatric care services. Christine is part of the State of California Coalition for Compassionate Care in the Pediatric Division, and she's also part of the POLST California Modesto chapter and part of the senior leadership team for the Hospice and Palliative Nursing Association Bay Area Nursing Chapter for Community Outreach. I couldn't think of a better person to present today. Christine is just a huge asset to our community at whole, and just has a great knowledge and resources that we're just very appreciative that she's willing to share. So Christine, with that, I'm going to turn it over to you. I do invite everybody, if you have questions throughout the presentation, this really is for you. So please feel free to enter them in the chat box so we can address those questions for you. And if you'd like to ask those questions yourself, please just raise your hand and we're happy to unmute you as well. So with that, Christine, thank you for joining us, and I'll turn it back over to you at this time.
Hey, thank you. Thank you so much. Welcome, everybody. Yes, I'm Christine Stewart, and I'm with Community Hospice, very proud of what I do and the people that we serve in our community, and happy that you could be with us. You know, PULSE has not been around for a long time, so it is still a new concept for people to understand what the PULSE is. So in our webinar today, Caring for the Caregiver, PULSE, what is that? Physician's Order for Life-Sustaining Treatment. It's different than, I'm going to end up doing an overview with you and telling you the importance of it and why we should have a PULSE. A PULSE is different than some of the other documents that you might already have, such as an advanced healthcare directive, or possibly a do not resuscitate form, or maybe a listing of your wishes. But this, on the PULSE, it's more specific because it allows you to work with your physician. It allows you to pick a person that's going to be your spokesperson that knows what it is that you do and don't want. And it just gives it gives it a lot more options and choices on it that you get to make decisions about versus some of the other forms that we have. One of the things people ask is, well, I already have an advanced healthcare directive. Do I need a PULSE? They're two different documents. So the answer is yes, we like people to have a PULSE. Let's see. I'm going to go over about how do you complete a PULSE, and I'm going to go over the overview of the form of the PULSE. You probably, if you haven't seen one before, it's a bright pink folder, or kind of, what do they call it, Kristen? Harder stock grade paper, and it's a bright pink. It's known throughout the state of California and through other states. It's like a common denominator, so it's recognized throughout the states. Not all states use the pink, but most of them do. So why would we use a PULSE? PULSE's wishes, often the other people don't know what their wishes are, and this is where we can put it on there. The Advanced Healthcare Directive, if you have one, it may not be accessible. On it, you might not have your wishes clearly defined. An advanced directive, you don't need a doctor's signature and an order, where on the PULSE, you do have a doctor's signature with that. What I tell people is that when you work on looking at a PULSE, it's looking at it like it's your plan of care. What is it that you want your care to be like when you are not able to care for yourself or make decisions for yourself? And so you pick out a person that can make the decisions, that understands what decisions you want. And And so when you go through making choices on that, that paper has to be taken to the physician and be signed by the physician. But what I like to really emphasize to people is that when you go to the doctor's office, one, you let the nurse's aide or the assistant know that you're bringing in your form and you want to review it with the doctor. If the nurse says, oh, okay, I'll take that and I'll have him sign it, that's fine, because we do want him to sign it. But I really strongly recommend that you tell the nurse that you want to go over it with the physician, because there might be questions you have on it. Also, you want to be able to explain it to your physician. What are your particular things that you have marked down on there, and go over it with him. He might have other input on it for you, knowing your overall health and some of the choices that you've made maybe should be a little bit slightly different on the choices. So I really encourage you, if you haven't done one, that you look over it as homework and then review it with your physician. And then this honors your wishes. Focusing on the conversation, yes, it's important to have this document with your wishes before you become seriously ill. So because I'm in this profession, you know, I had an advance directive many, many years ago because I just know about them and I want my wishes to be known. When POLST came along, I went ahead and had a POLST done also. Then I encouraged my folks to have one, each of them to have one done, because the last thing that you want to have is that you have family over or you're home alone and you end up calling 911 and you get taken to the hospital. You don't have these forms taken care of. You don't even have an advance directive. You're not in a condition to give the doctor or the nurses and tell them what you do and don't want if you have specific things. Your family flies in from out of town or out of state, and they have no idea for sure what mom wants. And there you are without your wishes being clearly known. So what happens in that case when you're in the hospital is the doctors and nurses are going to do what is the protocol of the hospitals, which is to sustain life at all possible ways, whether it's do not resuscitate, intubating with a tube for breathing, putting in feeding tubes. They go to all lengths to give you life. That's what the doctor's part of their oath is. So if you have these documents done, you get to specify what you do and don't want, or maybe you want something for only a short amount of time. But it's important that you talk about these wishes before you become seriously ill, before you have a fall and end up in the hospital. So when this comes out, we do a lot of teaching and talking. I just did another talk yesterday, and everybody in the audience was saying, well, I have an advance directive. Why do I need this? Well, because their advance directive doesn't necessarily list all the things that they do and don't want. Not to be confused with, there's an advanced healthcare directive for health, and then there's also the financial one, advanced directive for finances. Some people have it mixed in together, but it still doesn't always get down to the clear wishes of what you want for your own personal needs. And it's worth reviewing also, because things change along lifetime. So if you had one drawn up and made, say you had a living trust done 15 years ago, you might want to pull it out and look at it now, because there might be some changes you want, and all the more it would be important to use the POLST form. So let's take this example of this gentleman. He's home, he has a fall, he ends up, the neighbors call, he goes in the ambulance, and he ends up at the hospital. Now he's at the hospital and he doesn't have anything with him. Whether he has the forms or not, there's nothing with him. So, and they start in on all the treatments, because that's what the hospital is supposed to do. Treatments at any cost, all the treatments. So what ends up happening? So he gets into the hospital. He doesn't have an advance directive. We don't know what his wishes are, but one of the things that will happen during that stay is the social worker will come to him and say, do you have these documents? And he'll say yes or no. And if he says no, then they're going to want to get one started for him. Well, he's not going to be in a condition at that point to really do a POLST form, but it will be something that would be like homework later on for him to do with his family. Where if he had done it ahead of time when it was mentioned to him, he would already have it written down, and he wouldn't have that extra anxiety and stress of what it is that he does and doesn't want, and making sure that the doctors don't do certain things, that his family members know what he wants and doesn't want. So having that piece of paper just kind of relieves a lot of stress from the patient along with the family, because the last thing a family member wants to do is make a decision and then find out that that's not what dad wanted. An advanced healthcare directive, if you have one, it does not transfer around with the patient. If you have a do not resuscitate order, it does not have wishes on it. It just says yes or no that you do not want to be resuscitated. And overtreatments goes against you. Other patients goes against your wishes when they, like I said, if you don't have any of that documentation with you, when you get to the hospital, they will overtreat you, because that is what they're taught in school to do, that they will do, treatment of life at all extremes. They won't change anything about it until they've talked with a family member or a document becomes present to them saying what your wishes are. And then this can cause, unfortunately, it can cause unnecessary pain and suffering because of going through the treatments of the tests, maybe the lab work that they want, the different kinds of tests that they may be wheeling you off to go do, when maybe all you really want is comfort measures. Maybe you do not want to be resuscitated. You want comfort measures and you want to be turned around and go back home. They won't know any of those things if you don't have that document, or if you don't have someone there to speak for you in regards to what your document says and your wishes are. So what is a POLST? A POLST is a physician's order that is recognized throughout the medical community. It's a portable document that you keep with you. I always say make copies of it and give it to the family members, the people that are listed on it, give it to your doctor, but you always keep the original. So and that's would be the bright colored paper one, but you can make copies of it. So if you made, if you fell and you were home and you fell and you called 911, the paramedics would be asking you if you had one, and you would show them your pulse. Now, if they took you to the hospital, you would not give this to anybody to keep this. This would still remain yours. They would have to have copies of it. You want to keep your original. What is this? What does the POLST let us do? It allows the individual to make medical treatments that you want to receive and identifies the ones that you do not want. That's very important, because a lot of the ones that you might not want to have are the ones that would be definitely done without that piece of paper, because it's what is instructed by physicians to do, of treatment for life at all cost. The POLST provides direction for us as the healthcare providers during your serious illness without having to go back and forth to you and asking, or go back and forth to your caregivers and ask. It already tells us what you do and don't want. Now, on that form, people say, well, if I do this form, what if I change my mind? Can I change it? Of course you can change it. Just because it's been signed by the doctor and you've written it out in pen and whatnot, you absolutely can change it. In fact, we recommend that, every so often you pull out those documents, the living trust, the advanced healthcare directive, your POLST, and make sure that everything is up to where you want it to be. That you haven't that you need to make changes or don't make changes. Sometimes it could even be that you have a person listed to be your spokesperson. Maybe that person has moved out of state and is no longer convenient for you to have them speak on your behalf. Maybe they possibly have passed away. So it is good to every so many years to look at your documents to see if they're accurate. Another time to look at your documents when you've already had them set up is when something changes in your own health. You pull out those documents and say, oh, do I still want to do that? Boy, that was 10 years ago and I thought I wanted everything, but now I don't want everything. And you can go through on this document and it allows room for more detail. So like section A, it says CPR, cardiopulmonary resuscitation. You can say, yes, you want it, or no, you do not want it. Then the next section goes into medical interventions. Like, do you want full treatment? If you do want full treatment, do you want it for just a short period of time? And then what would your time frame be that you want it for? Do you want selective treatment? And you can list that. Or do you just want comfort-focused care? And you can also put additional treatments on that. You can specify on those things. Then it goes into talking about nutrition, and then it starts listing the people that you want on this form with you. And those are the three main things that happen when a person ends up at the hospital that are always questionable: it's doing or not doing CPR, the full treatment, doing feeding tubes of some sort or another, and doing respiratory tubes, the trachs. If you have CPR and then you can't breathe on your own, they put in a breathing tube. Those are all very big things in regards to when you first are getting treatment. And you might not want any of them. You might not want to have CPR, but they started it. And when they started it, they couldn't continue on without putting in a breathing tube, and you didn't want that either. Then you're unresponsive, and then you're unresponsive for maybe 4 days or so. Now the doctor is going to be talking to your family about putting in a feeding tube. You didn't want that either. You wanted only comfort measures. And now the feeding tube's in, and it's hard to get that out once it's already been done. So when you look at this form, there's a lot of things that are on it that are the primary things that happen automatically to you when you get placed into a hospital for an emergency type thing. But when you have the form, you're able to select what it is you do want and specify it. And that's why I say I like people to look over it as homework, if they, especially when they're doing it for the first time, and then take it with them to their doctor appointment so that you can go over it with the doctor. You know, you might be thinking that you want full treatment, but maybe you have a chronic lung disease that would be a problem for you if you had a breathing tube put in you. Well, that would be something to talk to the doctor about. He might suggest that maybe you're right. Maybe you shouldn't have a breathing tube if you were to have CPR. So all these things can be fine-tuned. Does it mean it can change down the way? Sure, of course it can. Just because it might be written in pen doesn't mean you can't change it, because you can. Do you want me to answer questions along the way? I see they're coming.
Yeah, so there are a couple of questions, and I think you're going to address one shortly, but we can ask it anyways. And that question is where do you recommend they store that POLST form? Do they carry it around with them? Do they just give it to their physician? What should they do when they have a POLST completed?
What I suggest is that the completed POLST, this is what I've done for my family, is the bright pink piece of paper. I take it and I put it in one of those clear sleeves so it protects it. And I keep that as our original document at home. But we make a copy of the pink sheet, and it can go, you can fold it up and put it in your wallet. You can put it in your purse. You can put it in the car. And you give copies to your doctor. You give copies to the people that you want to know about it. So you can give copies to plenty of the people around you and make your wishes known so that they know that. I mean, it can even go to a neighbor, even if the neighbor is not listed on here. You can give a copy to your neighbor. But the original pink one, I like to keep that one protected and at home, and then say that my dad ends up in the hospital. Then when I go to the hospital, I pull the original with me and take it with me when I go to see him.
Is there a specific place in the home that we should keep it?
Well, a lot of times what we've done with the do not resuscitate orders and with the POLST is we put the universal place is putting it on the refrigerator with a magnet, or if you are in bed a lot or in a hospital bed a lot, you can tape it on the wall above the headboard. That's the universal place that the paramedics look, is above the headboards or on the refrigerator.
Wonderful. Thank you, Christine. A couple other questions. So is there a way to keep it electronically, i.e. on your phone, as an example on your phone?
That's a good question. Somebody asked me that yesterday. I don't know about keeping it on your phone and making changes, because you always need a doctor's signature. However, with people getting the COVID vaccine, I know, including my family and myself, are taking a picture of the vaccine card front and back and keeping it on our phone. So that was something that I talked about yesterday in my group, was people could take a picture of the POLST form front and back, keep the picture of it on their phone instead of having a copy of it in your purse or your wallet, and then keeping the original at home. Now, as far as making an electronic document where you can make changes, I don't have any way of doing that. Not to mention that you would still need to have another doctor's signature again when you make changes.
Right. Perfect. I think our phones are so high tech these days as well. I know you can just scan documents into your phone as well through that.
That's true. Yeah.
So you probably, again, I don't know that a POLST is fillable, like a fillable form. So you probably have to have that hard signature, but you definitely could probably keep a copy of it on your phone. And then the next question is, where can I get a POLST form before my doctor's appointment?
Okay, good question. Oh, my light just is going out. Sorry about that. Looks like
don't move, huh?
Well, you can get I believe you can download it off the website, but it wouldn't be in pink unless you had pink paper. But you can download it on the computer and print it out. You can always get one by our office. I know that we brought some to people where we were yesterday. The doctor's offices have them. I'm sure the county probably does. I mean, we're advocating for these statewide and nationwide. So they're quite a few places. Can you think of anywhere else, Kristen, that?
I think you pretty much covered it. I would ask your physician's office, actually, and you could complete it with your physician.
Yeah.
You know, I do know that the POLST website also has them. That's where we downloaded a copy of it. But again, it was not on pink paper. It was just a white copy.
But I think you also put, you put the website for the POLST Coalition on at the end of our presentation, so they could go onto that website.
Correct.
Yeah, and get one. So that would be good. And it's good to print one out anyways, just because then you can start kind of looking at it like it's homework and start looking at it and making some decisions, and kind of like it's a worksheet, deciding what you want to do or not do with it. And it gives you areas to talk to your family about it. And then also then when you talk to your doctor about it.
Correct. And of course, for any participant that's on here, community hospice does have them as well. So if you would like one, please just reach out and we'd be happy to provide one of those to you as well. And then another question is, does a DNR, a do not resuscitate, transfer onto a POLST?
No.
Can you explain the difference maybe?
A DNR is just that. It's just one document that says do not resuscitate and is signed by the physician. The POLST the POLST goes in layers. So it's one document that's layered upon layer, like an onion. It starts off with do you want CPR? Yes or no. Then it goes down into the next part in regards to the medical treatments. Then it moves on to the next layer in regards to nutrition. And then it goes on to the next part in regards to what other documents do you have. I mean, it doesn't hurt. Yes, I have a DNR also, and so does my folks, but I still had them do a POLST because it's more, there's more information about their wishes on that one form. So can you keep the do not resuscitate form that has a doctor's signature? Absolutely, you can keep it. But what happens with the forms is those are two separate forms and they would have two different dates on them. So you can have them both. But usually what happens is whatever the most recent date is. So say you had a do not resuscitate form and you wanted to be a full code, but then now you have a POLST form and you don't want to be resuscitated. Aside from them being two separate choices, whichever date is the most recent date, that's the form that they will go by. That is the legal document.
Perfect.
Does that make sense?
And I see that somebody raised their hand. So Teresa, would you like to join us to ask your question or comment?
Yes, it's from personal experience. My husband had a DNR at Memorial Hospital, and then we had to transfer him to UC for a while, and then back to Memorial.
Right.
When we came back to Memorial, I did not understand that the DNR was not in effect. So we had to file another one.
Because
So
now you're in another institution.
No, we were at Memorial, Sutter Memorial.
Right.
We transferred to UC, we put one on there. But when we came back to Sutter Memorial, I assumed his DNR was still in effect but because we had left the hospital, it was not. So my question was, if there's a DNR in the POLST, and that's a document that follows the patient, does that DNR apply?
The DNR on the POLST? Yes, it does. Yes. So when you went to Memorial if you went to Memorial with the POLST that had the DNR on it and you showed it to them, then yes, that should have applied.
No, we didn't have one. This was
A long
9 years
time ago. Yeah, okay.
A long time ago. So I guess that was the confusion for me. Does a DNR, if you have it in the POLST, does it follow you no matter where you go? Or do you have to then fill out a new DNR at each site?
No, my understanding is if you have the POLST, you are showing that to them and they see that that is your documentation of saying what your wishes are. And then they can make a copy and put on the DNR and all of that into the file because you have your POLST with you and that follows you. What happens with just a plain DNR, in my experience, is that he didn't have the DNR at Memorial at first, right?
Yes.
Okay, then he went to
UC.
And he became a DNR.
Correct.
Okay, that stays within their system, but they didn't hand you anything. So then when he leaves and comes back to Memorial, he's back to Memorial without anything. So it's like starting all over again.
Correct.
If you had had the POLST with you and it said, do not resuscitate from the beginning, it would have stayed with you the whole time and he would have then stated, do not resuscitate.
Yeah, I mean, my point, especially at the time, was that it was a pretty hard decision to make the first time.
Yes.
At Memorial, then leaving and coming back.
Yeah.
Only accidentally actually finding out that he didn't have it anymore.
Oh boy.
Was very difficult.
Yeah. Yeah. And that is what you said about that it was very difficult to do that and making that decision. All the more that we really encourage people to work on doing a POLST form while they're healthy, while they're being educated about it, while the form is present, so that it's not done in the difficulty of a crisis or having to have family members help you with it. It's already done. You just have to have it pulled out of the, off the refrigerator or off the headboard and take it with you, or tell the family member, this is where it is, go get it and bring it back to the hospital for me.
Okay, that, I don't want to take up too much time,
That's
but
okay.
that, as you were talking, that brought up something
Sure.
else for me. You know, I'm relatively healthy right now. I'm
Right.
72 years old. So at this point, I would not want a DNR for me unless it was really extreme circumstances,
Right.
or life-sustaining things. If something happened and there was absolutely no hope of, you know,
Right.
of whatever, then yes, my ultimate wish is I don't want life-sustaining things. So how do you differentiate that in a pulse? It's like a what if.
Right. Well, what you can do is, what I would suggest is that you get one now and fill it out the way you want it. And it's going to be dated with the date now, or whichever date, you know, you get it signed by your physician this year. And then you periodically take a look at it and say, do I still feel that way, or do I want to make changes? Or what you can do now as you fill it out, you can write additional comments on it saying, you know, what you do and don't want, or yes, you would try something, but only for maybe a 2-week period. I think they talk about the feedings. Would you do it at all? You can even list in regards to, say, antibiotics. Yes, if it was a trial, you'd let them do antibiotics for a week. If there was no results, then you'd want them to stop. So you can specify things in the POLST. Even
Okay.
if it doesn't list stuff, you can write in additional orders and things.
And last question, does your spokesperson say, in my case, it would be one of my children, does that person have the authority to make changes if the pulse was not changed in advance?
If the pulse was not changed in advance, it depends. That's a very good question. If you are still able to make decisions and yet you want to change what's on your pulse, then you get to make the decisions.
But if you're not, and
But if
something
you're not,
happens,
but if you're not able
unbeknownst-
to make decisions, and say, if you're not able to make decisions, but say you and your child were just speaking about it the night before, that, you know, things were changing and you heard about it,
Correct.
you wanting to make changes, then
Yeah.
that's where your child would be saying to the physician, we were just talking about this and mom is now not able to answer, and this is what she was wanting to make changes on the form.
Okay, got it. Thank you so much.
Yeah,
So Christine,
because it
and
changes
to
your plan of care.
And to tag on to that, that's when they would be looking for your power of attorney, right?
Right.
So it's important to make sure that you have your power of attorney in place for healthcare decisions and.
Right.
And somebody had asked me a question about having the advanced healthcare directive for just for the health decisions. And well, what if it lists everything in there? Well, but it's not signed by the doctor. So it's just saying what your wishes are, but that changes. It's usually, a lot of times it's more vague. It's just basically a document that's giving your child or whomever permission to voice what your opinions are for your choices. It's not always specifying everything out. Sometimes it is, sometimes it's a little bit more vague. The pulse, you get to really specify and just dial it in of what you want your wishes to be.
So one additional question. So an example, maybe you can give us. Let's say somebody does have a do not resuscitate, right, signed in place. And then there's a POLST form that says that they do want resuscitation and CPR. And the POLST form is dated after the DNR. Which one, because they're contradicting to each other, right? So which one would be the one that would be followed?
Good question. That's a tricky wicket. The one that is the most recently dated, which sounds like the POLST is the one that you would go by. It also leaves room for discussion with the patient if they're able to discuss it or not, or else with their caregiver, of saying, I noticed that there's a big change on the previous form to this form, which usually it would be the switch way. It would be, don't just do CPR and then now do, you know what I mean, CPR, instead of you're saying it's switched. And so that opens up room for discussion, but legally, the most recent document is the one that they will follow.
Perfect. Thank you, Christine.
You're welcome.
A couple additional questions. So I should ideally have an advanced healthcare directive, DNR, POLST, and a living trust, right? And then it says, or am I duplicating forms and wishes?
Well, my answer is yes, because that's what I've done with myself and my folks. Do we need them all? I don't know that you need them all. The living trust is important because in regards to after a person passes, you don't want your family members to have to pay money on your estate, the probate court, and having things listed in regards to who everything goes to. So a family member steps right into that. So a living trust is very important. Advanced healthcare directive, that just right away gives whomever you give that permission to speak on your behalf if you're not able to. So that is important. The POLST is letting you have the power to speak on what your wishes are, especially if you're not able to, and share it with the family members that will follow with your wishes. And then the do not resuscitate order, that's becoming somewhat of an obsolete form. I still have one also, and so does my family, my parents. I don't know that you need both. If you have a POLST, I don't believe you really need a do not resuscitate form. If you have it and you have a POLST, and they are congruent with each other, it's the same decision, then it's okay. But I don't know that you need to have both.
And where would somebody go to get, is it an estate planning attorney who would be able to give them more details in regards
Yes.
to all of these forms?
Yes.
Okay. All right. And okay, I don't think there's any other questions at this time if you want to proceed.
Sure. And I don't have much more, and then I can take if they have any more questions. Little, who would benefit from the POLST? Somebody with a chronic or progressive illness, somebody with a serious health condition, and the medically frail. And like what Teresa was saying, well, she's relatively healthy right now. Why would she do one? Well, because you would want to do one now so that it's not in a crisis time. So you're thinking clear-headedly as far as what it is you do and don't want. And that it makes it very simple. It's not in a time of crisis, and adds it to anxiety and stress for you. So I always encourage, when you're learning about it, you might as well move on and get it taken care of. A little history about the POLST. It began in Oregon in 1991. It's expanded over half of the United States. I think on one of the slides we have a little a map of the United States, and there's only 1, 2, 3, 4, 5, only 6 states that are not using the POLST form right now. I'm surprised that there's even 6. I would think that most all of them would have it, but they're not. So the POLST is becoming very effective, and it provides care that is consistent with what your wishes are. And that's what it's all about, is your plan of care, your choices, regardless of whether you're able to be responsive to it or not, that your family and your doctor know what it is that you want and don't want. Here's the map in regards to the programs. The one in white, oh, I forgot to count the one up top. So there's actually 7 states that are not currently using. Well, they probably are by now. This was January 2014, and we're in 21. So my guess is they're probably using the POLST form now. And you see California, we're in the dark pink. We endorse using this form. Successes, POLST successes, Oregon, location of deaths. This is just some of the statistics. Using full treatment and hospital deaths, out of the hospital deaths, limited interventions, comfort measures only. You can see there's a big difference in number between full treatment and limited treatment and full comfort measures. And that's usually when you talk to people about what their end of life, whenever that is, and dying, what is the number? And I've done this for 30 years, death and dying. What is the one thing people always say? I want to be comfortable. I want to be comfortable. I don't want to have pain. And that's where on the POLST, you can say things in regards to comfort. So it's not surprising to me to look at this, this sheet, and it says comfort measures only was almost 12,000 people had chosen that. In California, we call it the CCCC. It's the Coalition of Compassionate Care of California. That's what Kristen was saying that I am a member of. We have a local chapter here in Modesto. There's a local chapter in San Joaquin County. There's the state chapter that's overall for the state of California, which also promotes and supports the pediatric division for a POLST. And yes, unfortunately, we do have to do POLST for children, which is another thing. But once again, we use it like a worksheet because it is able to be changed. You can make changes on it and it's okay. It's like a worksheet because things change with us. Let's see and here was the bill that passed for that in 2008 and then became effective January of 2009. One form, we use that one pink form for the entire state. It says use is not mandated. However, honoring the form is mandated. So that's important for us. And we in the medical profession does honor that form. The POLST, it does complement the Advanced Healthcare Directive form. And it is not intended to replace that. They're both legal documents, but in different capacities. This gives you a little bit comparison of the differences between the two. The POLST for seriously ill, frail, and at any age. Advanced directive for anybody 18 and older, because you know we have some people, young children, that have long-term medical health issues that they need that soon. They don't need it later when they're old. They might not live till later. The POLST is physician order for medical treatment. The advanced healthcare directive is general instructions of treatment. It's an overview. The POLST can be signed by a decision maker, and the advanced healthcare directive appoints the decision maker. So there's little things here and there, but they're both very, very important documents. This kind of gives you like a step down algorithm of when you should get the documents. So like it said, like we were saying, at 18, you could start doing advanced care planning, which is what I do with some of my children that are in the program. And then we move on to, you know, we just start talking about it. What is it that they need? What are they going to need? Moving on to completing it. And like I said, periodically, you always want to pull your health documents out and see if they need to be updated. And then you move along. Then if you get diagnosed with serious or chronic illness, or you have any kind of change in your health, then that's when you want to look at it again. And then as you start to have those things, which we naturally do as we get older, that's the time to complete a POLST form. So that's an important time to complete that. So yes, I've completed a POLST form also. And then it moves on to treatment, what did it say, wishes, about their wishes. There's also a document that we have, well, the treatment is honoring your wishes, but we also have another form that we use with patients if they want, and that's about their 5 wishes. And that's just talking, it just dials in even more clearly, what are the wishes and things that you want for comfort and quality of your life. Let's see, POLST versus the pre-hospital DNR. And this is probably what Teresa might have been talking about that they had before. There's similarities. It's a physician's order. It addresses the do not resuscitate, and it's intended for the medically frail or those with chronic or serious illnesses. The POLST allows for resuscitation. The pre-hospital DNR does not. It chooses DNR. POLST allows for other medical treatments and honors across all healthcare settings. With the pre-DNR, it only applies to resuscitation and is only honored outside the hospital. Is that right? Outside the hospital?
I think it's a pre-hospital DNR.
Oh, yes, thank you. Okay. Right, because it's for when you're going in for a treatment. Yeah, okay. And then there's the form there. And like I said, you would want to look through it, talk to your family or your caregivers or your children or whomever would be assisting with moving with your wishes so that they know what your wishes are. Talk it over. Then you would want to talk to your doctor about the POLST. Like I said, go over because it's your treatment plan. It's your plan of care, and talk to your family. And then of course, then you would be bringing it with you to a doctor appointment because you need to get it signed. Let's see, original pink POLST stays with you. Yes, at home, easy, put it in an easy to find location and give to the emergency personnel if they come. At the hospital skilled facility, they take a copy of it and it goes with you if you're transferred. So I always like to say, keep originals of everything with you and always make plenty of copies because copies are easy to hand out at the hospital, to the paramedics, to family members, to your neighbor, anybody that needs to know about what's happening, what your wishes are. The originals you need to keep in a safe place and keep them with you. Or like I said, you can put them in one of those clear little sleeves and have it pinned on the refrigerator or on the above your headboard. Let's see, and you can change your POLST at any time. Absolutely, you can change your POLST at any time. If you cannot speak for yourself, your healthcare decision makers may request a change based on the change in your condition. So, and I think we already kind of touched base about that. Yeah, that's why it's important also to talk to the doctor at the beginning when you're starting to do one of these forms. You might be making a decision that's not quite good for you based on whatever your current health condition is, and that your doctor would know that. And here's the website that you can go to, www.calpolst.org, where you can get more information on the POLST, and you can print out a form. And like Kristen said, you can always come to our office, and we will, those of you on the call, will give you a POLST form. You can go to your physician's office and get a POLST form. It'll be the standard pink color. But if you fill one out at home and you print one from the document from the website and you print it out and you know what you want and you know what you want to talk to your doctor about, You just take all of that with you to your doctor appointment. Then when you're at the doctor appointment, you can get the pink form from him or her and completely fill the rest of it out and then have him sign it. And then there you go. Then ask them to make a copy or scan it into your chart. And then you leave going home with that pink document signed. So I feel like I went through that pretty fast, but how about what are questions or
Any questions at this time? Anybody want to unmute yourself and ask a question or have a concern?
I do want to point out on this next slide here is that we have this one is through, is this the memorial one?
Yeah, so
Yeah.
we just invite you to join us for our next Caring for the Caregiver presentation, and that is how to support someone that is caregiving. Caregiving is a hard job. It's a hard job. So it's important that we all receive the support that we need and the resources that we need to care for ourselves as well as the person that we're caring for. So that presentation is going to be on May 13th at 11 o'clock a.m. same time. And it is the same link that you used today. You'll be able to join from that link as well. I don't see any other questions on here. Christine, I just would like to thank you for taking the time out of your busy day to share information in regards to the POLST form. I see a couple of comments just thanking you for the helpful information and how important this information really is. Again, we encourage you to talk to your doctor, talk to your family. These conversations are difficult, but they're very important to have. And then in regards to advanced healthcare planning, the POLST Living Trust, there are lots and lots of professionals out there that do estate planning. Do your research, contact them, and learn more information about those resources. I'm sure any of them would be happy to help you and get those items set up for you if you haven't done so already. So with that, we'll go ahead and end our presentation. If there's no questions or comments, I don't see any. And we hope to see you again on May 13th. And thank you very much for joining us.
Thank you. Be safe.
Bye-bye.
Bye-bye.